Hi there, my name is Allison Godley. I'm a physiotherapist at Habitat Health. I wanted to provide you guys with a quick and dirty video about fascia and why it's important. We're also going to go through a few myofascial release points and talk about the best posture to be in for running, walking, and sitting. So, what is fascia? Fascia is a thin layer of tissue that's below the surface of the skin. It's mostly water. It surrounds the muscles and it also envelops all of our organs. It's very important because it has links to our emotion. It also has contractile ability. Its uses are that it's important for force transmission. So basically when we're jumping on a hard surface, it allows us to spring back up. It also turns potential energy into kinetic energy so that we can keep moving and bouncing. It's also very important for cell metabolism and immunity. So basically there are conduits and blood vessels that flow through the fascia. And if the fascia becomes thickened or hardened, then it makes it so that we don't get fresh blood to the areas where we need it, including the organs. So it's very important that we take care of our fascia and think about our fascia when we're training and just in everyday life. So there's a few different lines of fascia. There's the superficial front line of fascia, superficial back line that goes from the head to the back of the feet. There's the lateral line, and there's the spiral line, which connects one shoulder all the way to the opposite hip and foot. There's also the deep line, which connects the organs, and then the arm lines. So we're going to go through a few different ways that you can release the fascia. I've actually picked just a few common anchor points. So anchor points are areas that commonly get quite tight, and this is when the fascia will anchor to itself and then anchor to the bone. Now, if any of us are used to sitting for long periods of time or even standing with one hip jutted out, it can cause those anchor points to inhibit our function. So I'm going to just go through quickly posture and some misconceptions around posture. So especially in the bodybuilding world and maybe even in the 80s, a lot of people were telling people to tuck their bum, get rid of that lordotic curve, which is the extension curve in the back. That's actually incorrect. We have curves in our neck and in our upper back and all the way down for a reason, and that's to absorb force through the skeleton and to allow us to actually contract into our deep core muscles and our glutes. So I'm just going to show you. A lot of people will activate their glutes and squeeze them together and tuck their bum like this. Now this is incorrect because what it does is it causes your center of gravity to come forward. It makes it very hard for you to tap into your lower belly core muscles, and it causes all of your back muscles to become really, really tight up into your rib cage. It also causes this to happen, so you get tightness in the front of the pecs and the chest. And that's really hard on your body. You're not able to get a good full breath. You're not able to actually tap into your glutes and into your core muscles. The best posture to be in when you're standing is to sit back on your heels and try to relax the glutes initially. Try not to tuck the glutes together and squeeze them together. You want to widen through the seat, and then you're able to individually activate one glute at a time once your seat is widened and your center of gravity is on your heels. Then you want to use your breath to expand the chest all the way around like a barrel. So you're thinking, keeping the chest expanded like this. Otherwise, you're coming forward and you're like this. So you don't want to squeeze the shoulder blades together really hard because that overactivates the lats and it overactivates the rhomboid muscles. And then you'll lose that ability for your opposite lat to attach to your opposite glute, which you really need when you're running. So important take homes to expand the chest, keep everything nice and wide and open, and try to sit back on your heels. Same thing goes for sitting actually. So when you're sitting, you want to make sure that you have a wide seat. You're going to widen your seat and sit back, creating that bit of lumbar curve, and then you're going to expand the chest, and then it's very easy to stay in this upright posture. Otherwise, sitting back on the tailbone causes this to happen, a sit-up position. Okay, so next video is we're going to go through all of the anchor points and how to get out of that poor posture and help you to retrain good posture. On the ground here now, and I have my really nice soft ball. You can use a softer ball if you need. A lot of people like to go really hard at the fascia, but it's actually not necessary. The most necessary thing is that you get on the right areas that are feeling tender and that you hold it there for long enough to create a change in the tissue. The other thing that's important is breathing, because as you're breathing, you're bringing fresh blood to that area. And sometimes doing some imagery, like imagining the muscle melting, can be quite helpful as well. So the first area that we're going to get into that's commonly quite tight in most people is the suboccipital region. So that's the region on the back of the head, right back here. So at the very top of the neck, and a ton of muscles attach up into there. And if you have tightness in the fascial chain, then you'll get quite a bit of anchoring and tightness in that area. So what I like to do is I like to lie on my back, put the ball right in the suboccipital region, just in the center of the head, and then I'll just sort of tuck the chin in gently, and I'll just sort of rock side to side. If you want, you can put your hand there, because sometimes the ball likes to flip out and be sassy. So what I like to do is I'll roll around a little bit and gently, just side to side. And sometimes I'll just sit there and gently press into it, and I'll take a few deep breaths. And you want to stay in that tight spot for at least 30 to 60 seconds. And then you can roll around and find another tight spot and do the same thing. So you want to be there for about 2 to 3 minutes on that one area. The next area that's pretty commonly tight is the pectoralis area. So this is located right underneath of your clavicles, your collarbones. And so you're going to find underneath the collarbones, and then what I'm going to do is I'm going to just sort of roll gently, looking for some spots. And once I find a really tender area, I'm going to hold it there, take a few deep breaths, let it melt, and then I'm going to roll around to the other side, try to find another area as well. So again, I'm going to place it on my mat. I'm going to lie on the mat like this, place the ball right underneath my collarbones, and I'm just going to hold it there. Take some deep breaths, because sometimes this is a mean area. If you're finding it's unbearably sore, then you can get a softer ball like a tennis ball, or you could even put a towel over top of the ball, and you're going to slowly roll around underneath that pec area. The next area that's an important spot is the side where the latissimus dorsi attaches, which is, so you'll find your armpit, and it's about 4 fingers underneath the armpit right here. And this is an important one to release, because if you have a tethering point here, it makes it harder for you to rotate in your thorax. And when you're running especially, we want to have really good thoracic rotation, mobility, but also strength in rotating the thorax. So I'm going to go on my side. I'm going to take the ball, put it right under here. You're going to look around for a spot. Sometimes one side is not that sore and it's like, I can't find a spot. Well, then you don't have to stay on that side. Try the other side and I'm sure you'll find something. What I'll do is I'll just find a tight spot there and I'll sit on it again, take a few deep breaths, wait for it to melt, and then I'll kind of roll forward a little bit, coming towards the pec line. Find some spots there, and then you can even roll back a little bit into the back. See if you can find any tight spots back there, kind of underneath the shoulder blade. So that's the other spot. The next one is just above the hip bone, the ilium in the back. So that is in the back, right above the hip here. So that is an area where the glutes end just below there, and then you have your back muscles attaching into it. Just above. So you're going to put it just above your ilium, right above your hip bone in the back. And again, same thing, you're going to roll until you find a really nice tender spot or a really tight spot. And see if you can take some deep breaths just to release that. So the ball is right there. Kind of roll. Sometimes it's nice to just kind of do some small little wiggles just to tell that fascia that it's okay to release. So you can do this on both sides. The next area that's important to get into is the attachment of the hamstring, which is right below the glute, right below the bum, so right here. So I'm going to put the ball right below here, and I'm going to lift my body off the ground. You don't have to if it's too much, but I'm just going to find a really tight spot. If you're starting to go numb or tingly, then don't stay there because you're probably impeding the sciatic nerve and vascular bundle. Just come to the side of that. find a tight spot and you're gonna hold it there. Usually it's to the lateral area, especially for women. And you're gonna take some deep breaths there to release the attachment of the hamstring. This can be a mean one. And then you can roll out to the side a little bit too, kind of get into this lateral attachment. We're kind of coming into the lateral line of fascia with this one. If you feel like it, you can continue down the whole lateral line to the knee. A lot of people have knee issues. It has to do with the lateral part of the quad being very tight. So you can kind of bring it all the way down. And then calves. Calves get very tight in runners. So what I recommend is starting at the very top by the knee. See if you can do some sometimes it's so tender you can't push very hard, but just do some little wiggles. Take some deep breaths and then see if you can apply a little bit more pressure as things release. We're sticking to the outside of the calf, just underneath the fibula there. And then you can push the ball down a little bit, see if you can find another spot. This is a really important area because a lot of the deep toe flexors are underneath here. And many people, if they don't have optimal foot strength, will use their toe flexors, which can inevitably cause things like plantar fasciitis. And it can also affect how the fluid is taken up from the foot. So it's important to get in here, release these toe flexors, and do a good foot strengthening program as well. And you're going to keep going down the lateral side, spending 2 minutes or so in this lateral line, and then you can take it to the middle of the calf. So you're going to start up by the knee, in the middle, see if you find any tight spots there. Good. Lowering down the ball. And do both sides. The other area I would suggest is the foot. So starting just in front of the heel, just rocking side to side, creating a bit of that space in the foot because our feet are often forgotten. And then you can roll into the front of the foot and even sort of curl the foot over top of the ball, just to get a little bit of mobility in some of those foot bones. So I would suggest doing this protocol at least 4 times a week, along with your regular stretching regime. And I hope you enjoyed this video. If you have any questions, please don't hesitate to contact us at info@habitathealth.ca. Thanks, guys.